Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. This podcast is on the recent NEJM article, the POPular PAUSE TAVI trial, continuation versus interruption of oral anticoagulation during TAVI. It was an international randomized open-label non-inferiority trial. 858 patients undergoing TAVI with an indication for oral anticoagulation. Randomization was 1:1 to continuation or interruption of oral anticoagulation. The primary endpoint was a composite of cardiovascular death, stroke, myocardial infarction, major vascular complications, or major bleeding at the end of 30 days. Key findings at 30 days. Primary outcome. In the continuation arm, 16.5%, that is 71 out of 431. In the interruption arm, 14.8%, it's about 63 patients out of 427. The risk difference was 1.7%, the p-value of 0.18. Regarding bleeding events, in the continuation arm, 31.1% had bleeding events. In the interruption arm, 21.3%, the p-value of less than 0.05. Thromboembolic events were similar between groups, 8.8% versus 8.2%. Clinical implications and conclusion. Interruption of anticoagulation reduces bleeding without increasing thromboembolism risk. It supports current guidelines favoring anticoagulation interruption in high-risk bleeding procedures. Limitations of the study: open-label design with potential bias, mostly transfemoral TAVI. Results may not generalize to other approaches. Conclusion: continuation was not non-inferior to interruption for the primary outcome. Interruption of anticoagulation may be preferred to reduce bleeding risk.